Welcome back. ABC-7 medical contributor Dr. Ogechika Alozie with Sunset West Health joins me now as we get a little perspective on some of the statistics we're seeing on the epstrong.org website. Dr. Alozie, wanted to start with our positivity rate. Right now, the 7-day average at almost 30.2%. New cases per 100,000. The 7-day average now almost at 217%. What's your reaction?
Yeah, so I think a couple of things. We've seen this pattern repeat other places, right? Whether it was South Africa, the United Kingdom, or the Northeast, New Jersey, New York specifically. Vertical cases and positivity rate going up. Our hope is that over the next 2 weeks, we'll start to plateau and then have that come right back down. So if you're at risk and if you're concerned about SARS-CoV-2, this is the time to protect yourself. And so we can get through this.
All right, now we're looking at total hospitalizations, the 7-day average now at 520, 25% of our capacity in hospitals now is COVID-19 patients. Is that, that's a jump. Naturally, we were down at 2%, but are we going to get to see those numbers drop at all?
Well, I think there's two things here, right? To answer your question about do you think we'll get back up to where we were in 2020, I do not think we will. And if you look at it, right, our cases right now are almost as high as they were in November of 2020, but the hospitalizations are about 50% less. That again speaks to what Omicron is right now, a virus that on average is less severe to people. And just as importantly, those that are protected by vaccines, where there's 2 shots or booster, are much more protected now. They're not as sick and they're not coming into the hospital as much. So I think we are on a good trajectory. Now, it's always tragic that the people have to come into the hospital and that we are losing lives. But I think the community as a whole is protected by this backstop of immunity. And I really do expect this to start coming down over the next couple of weeks.
And I was looking here as of today, 2,359 new positive tests in El Paso. Of course, we're not totally sure about that number because if people are self-testing, hopefully they're reporting it to the city, but I'm not sure how many really are.
Yeah, the reality is that they're not. And I'm not really sure that it's necessary for them to. Public health departments across the country have built this into their calculations. We're picking up 1 to 5 to 1 in 10 infections. So you can estimate that we have somewhere between 10 and 20,000 infections a day when that number is saying 2,000. And I think that's okay. Again, people need to understand when you test, if it's positive, isolate yourself, quarantine yourself, take yourself out of the community so that you're not spreading it. That's the main key. The numbers are made for policymakers and some other things that we need to do in terms of calculating hospital capacity. Everybody knows their health care. Everybody knows how to protect themselves as well.
ABC-7 medical contributor Dr. Ogechika Alozie with Sunset West Health. Thank you so much for coming on this afternoon.
Thank you.